Good morning, good afternoon, good evening, everyone. We're so glad you could join us today. And thank you for joining today's live Aspen Health for All session, Artisans Rise to the COVID Challenge. This conversation is part of a series of events which shine a spotlight on innovative leaders and experts who are rising to meet the COVID challenge. And as all of us know, COVID has hit hardest low-income communities and communities of people of color. And our aim is to focus on effective solutions that are grounded in community expertise and to issue a call to action so that you yourself can support work that's making a difference in these communities. We have a wonderful set of panelists who are on the front lines running fabulous producer entrepreneurial work on the ground, both in India and Kenya. And to begin our conversation today, we have a very special guest, C.D. Gillen, the president and CEO of the U.S. African Development Foundation. Hello, C.D.
Hey, Peggy.
Good, lovely to see you. Thank you so much.
Likewise.
To tell our viewers, the U.S. African Development Foundation was one of the very first organizations to jump in to ramp up philanthropic investment in COVID and building on their years of experience working with grassroots organizations all across Africa. And together with the Western Union Foundation, Resolve to Save Lives, and other donors, the U.S. African Development Foundation has helped to create the Aspen Artisan Alliance PPE Fund, which is providing grants and technical assistance to small and medium enterprises who are locally producing PPE, many of which you'll hear from today. CD is a remarkable person and a dear friend. He oversees a portfolio of $115 million in investments in more than 1,200 grassroots organizations and enterprises out of 20 country offices all across Africa. Before leading U.S. Africa Development Foundation, CD was Associate Director of the Rockefeller Foundation based in Nairobi, Kenya, where he led impact investing, digital jobs, and sustainability investments. And prior to that, CD was a White House appointee serving as the Peace Corps First Director of Intergovernmental Affairs and Global Partnerships. And CD, something I've just learned about you is that you were a volunteer in the first Peace Corps South Africa group during the presidency of Nelson Mandela. How fantastic that must have been.
What an honor, truly.
Wow, it's hard to top that when you have that early career. And CD is a dear friend. We both sit on the board of Root Capital together, and he's really a true champion for justice. CD, welcome. Thank you so much for supporting this work and the frontline producers we're going to hear from today. Thanks for giving us opening remarks.
No, thank you, Peggy, and just welcome everyone. It really is an honor, and all of you should know when the Honorable Peggy Clark calls, you just say yes. She doesn't even ask you the question. It's like, okay, hi, Peggy, yes. Whatever you're going to ask me, yes. So I'm really grateful to be a part of this, and that spirit that Peggy is always early, and the Aspen network really is always early to sort of reach out to others, to be a part of transformational change efforts. And so my dear friend Peggy mentioned the Artisan PPE Alliance and creating a fund to really support organizations. It was ADF should be a part of this, and it complements our other efforts. So just really grateful to all of you, and really grateful to you, Peggy, for even reaching out very early on earlier this year, and for bringing us all together in this important topic. As all of us know, countries around the world, including my own here in the US, we're experiencing a second wave of COVID, and this is especially challenging in Africa and the developing world. And unfortunately, as the world enters this second phase of COVID-19, we face the same persistent challenges, especially in low-income communities that we've been facing for 7 to 9 months, and 7 to 9 months later, as wave 2 comes, we're still, in the midst of wave 1. And the issue is persistent and still remains, and it's around a lack of personal protective equipment, PPE. This essential need for PPE presents challenges, and it's presented opportunities. And one of the major challenges are the prohibitive prices of importing PPE and the need to rapidly scale up local production. They're now setting us up for success as we continue to face this COVID-19 global pandemic. And this has created a health challenge that's combined with the economic consequences of 19. They're really profound and disturbing everywhere, and they're exacerbating food and poverty challenges, that food insecurity and poverty challenges that already existed. They are necessitating solutions that save lives and livelihoods, with the focus on immediate support for the needed local economic development challenge that everyone is facing. And the impactful innovations that we've seen from many of you, from many SMEs and community-based organizations, you've jumped into the fray to build and install hand washing stations, distribute sanitizer, make PPE for citizens and health workers, and educate community members. You are a true source of hope during this time, and it gives us real joy to be a part of the change and the transformation and the response that you're leading. You're not only meeting the need for masks and other equipment, but innovating to keep small businesses afloat and generating jobs and income for workers during these challenging times. So we're fortunate today, and for us, it's really an opportunity to hear directly from you. We're lucky enough today to hear from 4 frontline community workers. I call you essential workers. You know, you are heroes, global and community heroes, who are stepping in to meet the moment. And the U.S. African Development Foundation is proud to support SMEs and entrepreneurs around the African continent, and to bear witness firsthand to the innovation and the way that you are responding to and adapting your businesses to meet this moment. Again, really, really important now more than ever that we're meeting this moment that this global pandemic has presented to you. Know that USADF is in this with you. You're not alone in this effort and in this endeavor. We're here, we're working with you, we're looking for ways to support you and to bring in others to support you as you adapt your programs, your business models to meet the challenges that your communities face. Let me say this in closing, Peggy, and to all of you listening, we will get through this together, and we're grateful to all of you for taking the lead. You are responding, you're meeting this moment, and we're here to support you in any ways possible. We look forward to hearing from you and to being inspired by your leadership. So Peggy, thank you for this initiative. Thank all of you frontline essential workers, essential artisans that are helping the world respond to this global pandemic. Grateful to play a small role in supporting you, and just know we're here in this together. Thank you.
Okay. CD, thank you so much. Every time you speak, you always make me almost want to cry. And, you know, there's this idea of a warrior for justice, and CD, you are certainly that. And we will follow you anywhere. And we're so grateful. Just to start us off here, you know, this whole question of using this as an opportunity to support local businesses rather than importing PPE is so profoundly important. But as we know, it really hasn't happened very much. And so CD is really pretty brave to not think we're crazy to just start giving grants to producers on the ground who can make PPE and get it to communities quickly. So let me welcome our speakers today, my colleagues from Artisan Alliance member organization, Self-Employed Women's Association, Shining Hope for Communities in Kenya, and RefuSHE, who are leading the way in local community-based responses to COVID. First, let me welcome our representative from SEWA, the Self-Employed Women's Association in India. Established in 1972, SEWA is one of the best known women's organizations in the world. And I had the very great pleasure of visiting SEWA in the 1980s when I worked at the Ford Foundation, and SEWA was one of the very first organizations that organized informal sector workers and began to advocate for the rights of workers that were outside of the formal sector. It's a trade union. Beginning their work with trash pickers and cigarette beady rollers, SEWA has for the last several decades helped millions of women to benefit from dignified living wage work. And I've had the very great pleasure of learning from SEWA, from Reema over the years. She herself is one of the founders of SEWA. She was also a founding board member of the Artisan Alliance. She oversees SEWA's work with over 1.5 million members in 4,800 self-help groups, 160 cooperatives, and 15 economic federations across India and 7 South Asian countries. Reema serves on the World Bank Group Advisory Council on Gender. She was a member of the International Labor Organization's High-Level Commission on the Future of Work and she led the Women's Rehabilitation Program in Afghanistan. She's received numerous awards for her visionary leadership, and she's also known to sing at major events in Washington, D.C. So welcome, Reema. And Reema, welcome, good, thank you. And Reema's joined by one of SEWA's members, Saira Baloch, and she's a member of SEWA. She's been a member for the past 30 years, where she's risen from being a worker to a coordinator of the Patan district work, where she oversees 2,500 embroidery artisans and 30 seamstresses, and she manages all of the supply chain and retail operation. She also leads, interestingly, a young generation sustainable clothing label, Reema, this is so interesting, called Harkai, and is a member of the SEWA Trade Facilitation Center, where artisans are both the producers and owners of the business. So namaste and sawagat, Saira. And Saira will be speaking with Reema as her translator.
Saira ben tamne namaste करे छन.
Namaste.
Good. And let me introduce our next speaker, Virginia Matu. And Virginia she leads the Women's Empowerment Program at Shining Hope for Communities, SHOFCO, that works in the largest slum in the world, Kibera slum in Nairobi, Kenya. Shining Hope for Communities is a globally recognized and award-winning grassroots movement that catalyzes large-scale transformation in urban slums by providing critical services for all, community advocacy platforms, and education and leadership for women and girls. Welcome, Virginia.
Thank you.
We're delighted to hear about your work. Talk about people who are just jumping in to solve problems. What SHOFCO has been able to do in Kibera slum is talked about all over the world. They just jumped in to the COVID response. And our next speaker is Stephen Kithusi. Stephen, I hope I pronounced that correctly. You can correct me if I'm wrong. He's the Artisan Business Development Manager for RefuSHE in Kenya. RefuSHE is an Artisan Alliance member. It was quite interesting. They protect, educate, and empower orphaned, unaccompanied, and separated refugee girls and young women to help them build healthier and more resilient futures for themselves and for their children. Working with refugee women and girls from Somalia, Burundi, and other countries, RefuSHE offers a very interesting integrated holistic package that includes psychological support, rights-based development, and economic support, helping really the most vulnerable women and girls to get back on their feet. And the Artisan Collective at RefuSHE is a centerpiece of RefuSHE's work, and it serves to both empower women and provide economic and leadership opportunities. And RefuSHE was also one of the first founding members of the Artisan Alliance. So welcome, Stephen. We're so glad you're with us today.
Thank you so much, Peggy. I'm glad to be here today.
Beautiful. Okay, well, let's get started. I want to thank all of you who are on the front lines of this work from taking time out from your very busy lives to share with us and provide a little window into how you are responding to COVID. So to give people a sense, since none of us can travel, of the front lines and what it looks like and where you're working, we'd like to show a little bit of a video and some photographs to give our viewers a sense of the wonderful work you're doing. Izzy, do you want to tee up the video? And I think the first is Self-Employed Women's Association.
These are the garment workers trying to stitch PPE sets. And so you're watching how people are cutting and literally bring PPE and show them because this was such a new kind of style and a pattern. And then the members innovated that, oh, but the frontline workers that we are going to serve, what kind of PPE suits would be much appropriate for them? You'll see them how they innovate and stitch PPE suits, which are very comfortable when the women waste collectors are collecting waste wearing the PPE suits, or the food processors working in the kitchens, wanting to serve foods to the people who are in the old age homes or who are stranded and taking shelter, or they are refugees and they serve food. So look at the PPE suit, which is already. Whether you work in the heat or you work outside on the streets, you don't feel uncomfortable. You are much relaxed while you're working, and yet you are protected.
Thank you, Reema. That was beautiful. And these are more images from SEWA. I want to point out that there is high attention to quality of the products. These are some of the images from SEWA's masks. They're quite beautiful as well as very high quality. It's quite a large workshop and factory. As you can see, this is a strong and viable business.
We have 150 garment workers and 15,000 artisans. And Saira is a coordinator of a cluster where some 2,500 artisans are located in a very dry desert area.
Wow, 2,500, that's a lot of jobs. That's great. I think the next one, this is from Shining Hope for Communities, SHOFCO in Kibera Slum in Kenya. These are really beautiful masks, Virginia. As you can see the care and attention to the quality of the product. They are meeting Ministry of Health standards in Kenya for the quality of the products.
Yeah, so these masks are made by a group of women who are living positively with HIV in Kibera and Dar es Salaam, which came together for empowerment, and they've been trained on how to do tailoring. And since COVID happened, they jumped in and they started doing this in response, and much more to protect the community against Corona and help so that in Kibera and Madara we are not affected, because from the initial time it was, if it gets to Kibera, it will be a disaster or Madara.
Okay.
So just
thank you, Virginia.
we
Great.
started doing.
Point out one thing, Virginia, that some of the organizations are making different kinds of PPE, including surgical masks, which you just saw, and those are of a higher quality. And we, for example, Shining Hope for Community, this center in Kibera Slum has produced, and another slum has produced 60,000 masks in an order we were able to broker for them to deliver to community health workers who will be involved in testing and contact tracing. So there are different grades of PPE, both gowns and hats, and also different types of masks. That's Shining Hope for Communities. Sabra, is there another? And then this is an image that gives you a sense of Kibera. As you can see, they're delivering the PPE, and Shining Hope for Communities is a superstar in the Kibera Slum in so many ways. This is a beautiful image that shows you something about the very crowded conditions, which makes COVID even more serious. SHOFCO immediately setting up hand washing stations, and this little boy, Virginia, I think he's teaching people how to wash hands properly. Is that right?
Yes.
Beautiful. And then we can move to RefuSHE, some images from RefuSHE. which is working with refugee girls. This is Stephen's program. The beautiful pattern of this mask is part of the way that RefuSHE works with their artisan collective. Each piece is unique and hand-dyed.
Yes, this is one of the girls who we have 21 artisans, Peggy, in the Artisan Collective. So they were making their tie and dye. They were adding value to the fabric, and it was their first time to make PPE. So it was a very exciting time for them.
Beautiful. I think those are gorgeous. I think most of our viewers will want to buy all of these masks. So let's begin our conversation. Let me tell everyone who is viewing our viewers that please put your questions into the Q&A button, and we'll be getting to those at the end of the call. We would really love to have those. So go ahead and submit your questions now throughout the talk. So let's begin with this. I think as everyone knew, when COVID hit in March of this year, we really thought that Africa would not be hard hit. It looked like it was going to be the pandemic that didn't hit Africa, which was a wonderful thing. But 8 months later, we're seeing that COVID is still with us and will still plan to be with us. In Kenya, infection rates are increasing. While cases in India are beginning to decline, India has been hard hit. Really in the world, one of the worst hard hit, with 1 million active cases and an estimated 62,000 cases per day. So I'd like to start by asking each of you, how are families being affected by COVID in your communities, and how has your organization responded? Virginia, let me start with you. Can you unmute yourself? There you go.
Yes, hi again. We've really been hit by the virus, and the most serious effects have been economic impact. So most people have lost their livelihoods in the urban slums, like the job sectors they were involved with most of them have been closed, like the washing or cleaning. They used to clean clothes, others used to be in security, others in the hospitality business, which has been really affected, and they shut down due to the virus. So many families are now living at the edge of survival with less than $2 a day in savings, and they cannot feed their families, and they are forced to go out and look for work. Even if that makes social distancing impossible, they don't have a choice sometimes. Yeah, so SHOFCO has been the largest COVID-19 responder in Kenyan's urban slums. And our response includes multiple activities, that is door-to-door health screening, distribution of clean water and food packages. We also have an SMS-based rumor tracking program to fight the misinformation, and that comes with the virus. You know, there's so much rumors about it. We also have our Women at Sun group, which is called SWEP, SHOFCO Women Empowerment Project, that I personally run. And for the women that have positively living with HIV, and we engage them in handcrafts, so for them to earn a living, that is. And SWEP has been focused on using their tailoring skills to produce PPEs like masks. They're also doing gowns for the SHOFCO clinics and also door-to-door distributions. They're also involved in soap production, liquid soap production, and also repackaging of sanitizers, which is being distributed to the community.
Good. Thank you, Virginia. Reema, tell us a little bit about how COVID has affected your communities and how SEWA has responded.
Sure, Peggy. We are now entering into a second wave, which has been even more rapid, and looks like, you know, it's going to unfold much rapidly. We have 46,000 new cases reported just a single day in one city where I am, in Ahmedabad. And I think when the first time COVID hit in end of March and early April, you know, in less than 4 hours, there was a complete lockdown that was imposed throughout the country. And lockdown, social distancing, washing of hands if you're living in a dry desert area, all these were very new concepts, and the work came to a grinding halt. Our production facility, as you saw in the video, was running at its full capacity. We had huge orders which we had to fulfill, and everything came to a grinding halt. The women artisans, the other women in different trades like waste collectors, construction workers, small farmers, everybody's livelihoods came to a grinding halt. The flow of income stopped in the families. SEWA did a rapid assessment to see what's the situation of our members after a week, and we found that 73% of our members had completely lost their livelihoods. 63% of the women, their food intake had gone down to just one meal a day. 35% of children, and that too girls, will be dropping out of school. And after about 3 months, when we did another survey, we came to know that 23% of our members were now on the streets because they couldn't afford to pay the house rents or the electricity bills or the water cess. And I think what we have learned repeatedly in different disasters is that work is a healer. There was so much of anxiety that, both the men in the families, the women, everybody's work had stopped, income had stopped. We didn't know when will we be able to restart. We had old debts which had to be repaid, therefore new debt wouldn't be possible. And so how do you do that? And there were four things that we immediately worked on. Everybody had to wear a mask, and where will you buy all these masks from? So we started giving raw material to the women, and they started stitching masks at home. And we made small videos and sent them out on WhatsApp, on YouTube, so that women could see and start making masks. First, manually, and then using machines. So that started giving hard cash income to the families. So we had about, close to 3,000 women who made more than 500,000 masks in almost 4 months. And then we started supplying them to the government hospitals, to the private hospitals, to the frontline workers in the villages, in the cities, everywhere. And we put it on our website, on WhatsApp, on social media. And so we started getting a lot of orders, which my colleague Saira would also add. The second thing we started doing was that women who did not have the skill of stitching, we gave them waste paper so that they could convert it into envelopes, into paper bags, because you are a plastic free nation. And we started procuring those and started giving cash income. And the third thing we did was that women have an inherent skill of cooking. And this was the time when all the children were at home, everybody was at home. So we asked women we supplied them with raw material, with packaging material, and then with standardized formula. So they started making dry snacks, and packaging it, and started selling it 10 rupees a package. So 500 women were making snacks day in and day out for 6 months. And that's how income started coming in. And so violence against women then started reducing. Otherwise, the men were all at home. If you're sitting in a small little hut with 8 members, 11 members, not allowed to go out, there's so much of anxiety, there's no money. And so who were the victims? It was the women in the families. The adolescent girls were also sexually getting abused because, everybody was there and there were these young girls in the family. And then how do you engage children? They were all out of school and didn't know what has happened all of a sudden. So we had 27,000 children whom we used in designing posters, in designing videos, in designing little pamphlets with the messages of, COVID and what are the safeguards, why the social distancing is important, why do you need to keep washing hands every now and then when there's no water. Everybody feels that, oh my God, where am I going to find the water to wash my hands? So, and therefore the use of sanitizer if there's no water. And, so children were making posters, videos, and they were making scripts for it. And and the biggest thing was, how do you turn yourself digital? And I think, that was what we had to really adapt. So after now almost 6 months, I'm so glad everyone is, they all got from the little savings, they all have smartphones, and now everybody is on Zoom, on WhatsApp, on Google Meet, and on, Microsoft Teams, having trainings, having meetings, and trying to sell things. I spoke too much. Thank you.
No, it's beautiful. I love what you said about work as a healer. My father used to say that to me, and I just think, what? How could that be? But also making the connections between the rise of violence against women and how if a woman can be an income earner, how that can really help that situation. No, Reema, we always want you to speak too much. That's what we look to you for. You're our muse. Let me turn to Stephen. Stephen,
When I talk too much, you just alert me.
I will. Stephen, let's turn to you. Tell us a little bit about the very special population you're working with in Kenya and really what's happening with the COVID situation for the communities you work with, and how has Refugee responded?
Thank you so much, Peggy. It's exciting really to listen to Virginia and Reema and realize that the same challenges they have actually faced are the same challenges that refugees are actually facing. I think one of the important things to mention is that refugees are very challenged because when they move from their countries to foreign countries, very unfamiliar territories, there are opportunities that they cannot get like the citizens of that country. And one of the challenges for refugees is employment. And so most of the refugees are self-employed. They have small businesses. One of the effects of COVID-19 for the refugee women that we work with is they lost businesses because now the government said, we stay at home and, restaurants were closed. Most of refugee women have, hawking items, food items, they have, food shops. And so that means then they don't sell their products, they don't sell their snacks and their food, and they had to close down and go home. So of course, that definitely means there's no revenue and no money to pay for their rent, to buy food and to take care of their children. So that was one of the effects, the economic effects that we got. We had to close our campus, and we have an education program. And definitely that meant no education for a period of time. And we work with a very sensitive group of refugees that have to go through counseling on and on because they have trauma, PTSD. And so trauma adds a very layer of complexity to the refugees because they need that counseling over and over. And so some of those challenges are mental issues and education issues and economic issues. So one of the things we did just to respond to those three pillars I've mentioned was, for education, we moved into virtual classrooms, basically using Google Meet and leveraging WhatsApp platforms to do our classes and making sure that the refugee girls that we work with are able to still continue with education even when they are at home. Again, secondly, we leveraged the virtual platform to provide counselors who are on standby 24/7 to offer any counseling to the girls. So that was very important because of the trauma issue. But also we were able to get an opportunity at some point to reopen and use the social distancing to allow PPE making. So we were able to come up with PPEs, not just to meet the demand for PPEs in Nairobi because the demand was so high, but also to provide face masks for the refugee women. You know, you're looking at refugee women who cannot now afford to buy food. You know, they will ask themselves, do I buy food or do I buy a face mask? So at the end of the day, we thought it would be good for us to make PPEs and, you know, give and support the refugee women. So one of the ideas we used is we will tell, you know, most of the Kenyans when they are buying the face mask, when you buy one, you support a refugee with one. So that really made the Kenyan community and the refugee community one community to fight against COVID. It was no longer refugees and the Kenyans. So it was really a very exciting journey to see how we were able to respond to some of those issues. So just to give a summary of some of those challenges, refugee women are really a very disenfranchised group in our community because they only depend on informal jobs or maybe small businesses that they run. So even as we are moving to the second wave, that has been a challenge. And we have gotten partners that have worked with us. And one of the things that we were able to do just to cushion the effects of you know, lack of revenue in their businesses is giving them grants to restart their small businesses. So we hope that is going to have even greater impact as we continue. Thank you so much.
Wonderful, Stephen. Thank you so much. That gives us such a helpful sense. And, you know, at the end of this conversation, you will all be able to connect with these organizations and figure out how to support them, as well as how to buy those beautiful masks, I hope. But let me turn to you, Virginia, and then Reema will have a chance to go to Saira with you translating. Virginia, I'm interested in what have been, from your perspective, running this Big Sweat project, what have been the biggest challenges that you faced? And I know that many people are holding up SHOFCO as an example of what grassroots community organizations can do to respond to COVID. But I have found, even with this PPE fund, that people are really skeptical that producers refugee producers can make decent quality work. And when we look at the images of your work, we can see that it's a very viable workshop and you're paying attention to quality. So did you find skepticism amongst the part of others about doing PPE production with your women in the slums? And how have you overcome those challenges?
Thank you again, Peggy. So we've had challenges in the beginning, like this was a new thing we were doing, and it's new virus, it's new kind of disease. We are not sure where we are going, how it's supposed to be. We are not even sure of the quality of PPEs we are supposed to produce. But with time, we were able to learn through getting recommendations from the KEBS, also from government, and we were able to start making the surgical masks and also the PPEs for our clinic staff. Also, we were able to start making the liquid soap because generally we were doing the PPEs, but we thought also the liquid soap was a very big plus because we were doing hand wash. SHOFCO has set so many hand washing stations, and each hand washing station has to have soap. And also we were sensitizing the community on hand washing. We were also doing door-to-door sensitization. So it was a very good idea to start doing that. And also we were able to get sanitizers and repackage into small bottles for distribution throughout the community. Yeah. So the challenge, there is also the biggest challenge, the latest, that we are in the second wave of coronavirus. And it just happened after the lockdown. So, and so far, about 5% of all the cases in Kenya are located in Kibera and Mathare, which are the two biggest slums. So there is concern that the outbreak could still get much worse. And as SHOFCO, we are still continuing with the screening. So we have screened so far 1.8 million people for COVID symptoms at our clinics and house level outreach. Also, we have done this in coordination with 820 Nairobi County health workers. The suspected cases are being referred to the Ministry of Health for testing and quarantine. We also continue with our hand washing and sanitation program. That is, we have around 49 million users of our 354 hand washing stations across 17 sites. And these hand washing stations, we are making sure they're located at entry points so that people, when they're coming into the slum, they are able to wash their hands to help fight the virus. And they are manned by volunteers, which are also earning a living from that. We're also doing provision of clean water. Like in Kibera, we have already distributed 7.2 million liters of water. That is through our innovation of aerial piping. We've also done 19,700,000 liters via water trucks, which are being distributed to other points, our slum points. We also did distributions. That is, we distributed the soaps to doorsteps, and so far we've done distribution of 408 510 soaps and 265 942 hand sanitizers. We also have the SMS platform where we are trying to provide more information on this virus, and so far we have enrolled 351,054 contacts in our SMS platforms. And we're also able to analyze surveys which we are collecting from the community. We've already reached 7,643 household levels of the surveys. Yeah. Another challenge we are facing is the lockdown, the economic impact of the COVID. So we really need to find new ways of creating jobs locally. Yeah. And so far, we've also engaged with our partners in cash transfers to support families which are really affected and they lost their livelihoods. So through Give Directly, which we are partnering with, we've reached 34,600 vulnerable families with cash transfer programs through our SHOFCO urban network. Yeah.
Beautiful. Thank you, Virginia. Let me turn just with a little bit of a follow-up question. A lot of the Artisan Alliance members, and many of whom are watching this today, are making cotton masks, but I understand that you immediately jumped in to try to make PPE gowns and also surgical masks, just getting those materials in the market, finding the patterns, because you had clinics there and you needed to find ways to give PPE to your health workers. And I understand that you pay a lot of attention to the quality standards, but it's difficult to get those masks certified because of the bureaucracy at the government level, but that you are producing a range of PPEs. So what would you recommend to other small artisan businesses that are watching this and that want to not only create cotton masks, but also move into making other types of PPE?
I think the most important thing is to know what you want to do to produce in terms of the quality, because quality is key. You can produce this mask and still not help. So we focus on getting the best quality materials from our suppliers. So we've really worked on getting the right suppliers and getting the right quality of material, and also working closely with the government to know the right quality of products or PPEs we should be making. And every time we are gathering more information on any changes on the recommended PPEs. So it costs a lot of money and also time. And because
right,
our health comes first. Yeah.
Yeah, no, that's so important. Let me turn to you, Reema, so Sarah can join us. We'd love to hear a little bit from Sarah Ben. And so if we could bring up Sarah's video. And Sarah, I think that Reema will be translating for you. And let's see if we can get Sarah's video up. Sarah, you've been a member of SEWA for more than 30 years. So tell us a little bit about how you came to be a part of SEWA, and in this moment of COVID and this important role you're playing with the PPE project, why you think that this is important work and is making a difference.
સાયરા બેન, પેગી બેનનો પ્રશ્ન એવો છે કે તમે સેવાના 30 વર્ષથી સભ્ય છો, તો આ જે કોવિડ થયું એમાં શું અનુભવ રહ્યો, અને આ જે પીપી અને માસ્ક બનાવવાનું કામ છે તે તમે કેવી રીતે આખું વિચારીને શરૂ કર્યું, અને એમાં જો કોઈ તકલીફો હોય તો થોડું બોલીને અટકજો એટલે હું ભાષાંતર કરું, અને બહુ લાંબુ નહીં, 3 થી 5 મિનિટમાં.
એટલે હું 30 વર્ષથી સેવામાં છું, તો ઘણા બધા અલગ અલગ અનુભવ તો થયા છે, બધી આફતો બી ઘણી આવી છે, પણ આ એક અલગ જાતની હતી કે જે કોવિડમાં બધાને અલગ જ આખા રૂપ આપી દીધું હતું કે બધાએ જ એકબીજાને મળી ના શકે, એકબીજાને નહીં. તો એમાં ખાસ કરીને જે અમારે બનાવવાનું તો કે પીપી કીટ બનાવવાનું આવ્યું, તો એની માંગ આવી, તો કેવી રીતે અમે આ બધું કરીશું. તો એ પીપી કીટ વિશે સાંભળ્યું હતું જ પહેલી વાર, પીપી કીટ શું છે એ જ ખબર નથી.
I've been a member of SEWA now for 30 years, and we've faced series of different disasters. We had earthquake, we had cyclones, we had an epidemic and outbreak of malaria in our region, we have floods, but this pandemic was a new kind of experience that we were going through. The whole lockdown and social distancing, it was an unheard of kind of experience that we were having. Nobody can leave their homes, nobody can meet each other. And then there was this PPE kit. I mean, we were hearing it for the first time, that what's this PPE kit and how does it look like? So we had to really educate ourselves right from there, that what is this PPE, why is it used, how does it look like?
પીપી કીટ વિશે અમે ગવર્મેન્ટ સાથે જે લોકલ રેફરલ હોસ્પિટલ છે એની જોડે સંકલન કર્યું ને ત્યાંના ડોક્ટરો સાથે મીટિંગ કરી, અને મીટિંગ કર્યા પછી જાણ્યું કે પીપી કીટ કેવા પ્રકારની છે એના ત્યાં બી અમે જોયું અને એમના દ્વારા જાણ્યું. અને સ્પેશિયલ અમારા જે માસ્ટર ટ્રેનર છે, તો એ માસ્ટર જે હતા એને પણ અમે સાથે રાખ્યા મીટિંગમાં, અને કયા પ્રકારના એમને અલગથી ટ્રેનિંગ.
So therefore we went to the local government hospital and we arranged a meeting with the doctors there, so that they could orient us that what is this PPE, why is it important, what is the objective of having the personal protective suit that we had. We also kept our master cutters and pattern makers in that meeting, because it is very important for them to understand. We also requested them if they can show us as to a sample, how do you wear it, what kind of material is used in the PPE. So we got that very detailed, intensive training done by the government referral hospital.
અને એના સ્પેશિયલ કાપડ માટે બી, કેમ કે કાપડ બી આપણને ત્યાં નતું મળતું, પીપી કીટ બનાવવા માટે કાપડ બી. તો પછી અલગ એક મિલ સાથે સંકલન કરી અને આપણે એ દરમિયાન લોકડાઉન દરમિયાન આપણે કાપડની વ્યવસ્થા કરી, અને કાપડ લાવ્યા પછી આપણે પીપી કીટની આખી તૈયાર કરી. અને બધી અલગ અલગ જગ્યાથી માંગ બી આવી, નગરપાલિકાના સફાઈ કામદારો માટે, પછી આપણા જે કમલાની બહેનો છે, પછી આશા વર્કર બહેનો છે, એમના બધા માટે અલગ અલગ બનાવવાની અલગ અલગ રીતની બધી માંગ આવી. તો આટલા બધા પીપી કીટ બનાવવાના હતા, તો આપણે કઈ રીતે આખું કરશું, તો એની કાપડ આવ્યા પછી.
So then we had to also arrange for the material, because the material that is used in making of PPE is of a different kind. So we started contacting the different cloth mills in the city from where we could procure the material, and then we procured it in bulk, so that our PPE suits are much more economical. And that's how then we got the material, and then we started making, and then we started getting a lot of orders. We also wanted to ensure that we only not look at doctors and nurses in the hospitals, but there are workers who are collecting waste from the streets, who are working on the community kitchens, ASHA workers, these are the village health workers who will provide them with those PPE kits, because they are so expensive, and by the time the government provides them, so then we started making kits, and we also started getting orders from different municipal hospitals, from the government hospitals, from the private hospitals. So the demand started increasing.
તેવી જ રીતે પીપી કીટની સાથે સાથે માસ્કની બી એટલા જ બધા ઓર્ડર આવવા માંડ્યા. એમાં બી પછી સ્પેશિયલ માસ્ક આપણે આખા 3 લેયર 2 લેયરના કેવી રીતે આખા માસ્ક પણ આપણે તૈયાર કર્યા, અને એ માસ્કના બી આપણે અલગ અલગ ખાસા કંપનીઓના ઓર્ડર આવ્યા લાગ્યા, કંપનીના વર્કરો માટે ઓર્ડર આવ્યા, ગામની આપણી બહેનો, પછી આપણા જે ગામના દૂધ મંડળી બનાસ ડેરી જે મોટી છે એમાં દ્વારા ઓર્ડર આવ્યા, અલગ અલગ બધી મોટી મોટી કંપનીઓના બી ઓર્ડર. એટલે આપણા માટે બહેનોને રોજગારીની બી જરૂર.
Along with the PPE suits, we were also started getting orders for masks. And then there are different styles and kinds of masks, which we learned for the first time, N25 and N95, and which are the masks which the doctors can wear, which are the masks which the nurses would wear, which are the masks which common people have to wear. There are 3-layered masks, 2-layered masks, also using filters in the mask. So all that also we started learning, and then we started getting orders from the different companies, from the corporations for their workers. Also in the villages and in the cities, people wanted. So suddenly there was, all the activity got revived, and so we had to ramp up our production, and all the women whose work had come to a standstill, now we were able to give work to almost 500 women who started stitching PPEs and masks, and they got regular work and income. So
Beautiful.
we had to gear it all up in a short time of just 1 week, and then but quality had to be maintained, because that is what was so crucial. So that was, and so we started training young girls who were educated into as quality checkers.
Quality check, fantastic. Okay, I think we have lots of wonderful questions coming in. I do want to say this is just an amazing story. I think one of the things we've all learned in this crisis is there are people that just jump in and start responding to the work, and there are others that sit back. And all of you have just jumped in. I'm also aware of the fact that so much of what you're sharing is so useful for other producers all around the world. So I think that we're going to figure out ways that we can keep learning more, for example, about the quality checkers and others. But let me move to some questions from our audience there, because there's a lot of great questions coming in. Some of them are very specific and practical, which are wonderful. So let me start with this first one from Lloydie Zeiser. Virginia and Stephen, I will be in Nairobi for a month starting January 17. I work with 180 women in compromised communities around Nairobi. How would I facilitate buying 200 PPE masks for my women? I would like to split the order between the two organizations of yours. So happy to hear your stories. As I was going to buy these masks in America and bring them with me, now I can support your programs with my order. How much per mask, please? Stephen and Virginia, over to you.
Yeah, I've seen Lloyd comment. I've actually responded to him on the chat on the question. It's exciting really to hear that. Actually given him my email so that we can continue the conversation. But it's exciting. The need is there, as I mentioned earlier, for face masks in the community. So we can pick up the conversation from there.
This is great. Thank you, Stephen. We love to be this kind of brokering platform. And that's really how this whole project started. Virginia, did you want to add anything to that? About how can buy masks from you?
Thank you, and thank you, Lloyd. Thank you for being interested in what you are doing, and I'll give you my email address, then we can take it from there, and we'd be very happy to support you. Thank you.
Beautiful. All right, let me take a second question from Frederick. Quite an amazing work being done by SHOFCO in the slums of Nairobi. Thank you very much. Does your program have an outreach to the rural parts of the country, which are now recording increased infections of COVID-19, where we also have majority of the vulnerable communities? Many families in the villages cannot afford PPE for their school-going children, and many of these schools do not even have hand washing points or stations and soap. How can we reach out to these communities? Virginia, do you want to take that one? And Stephen also?
Yes, Frederick, thank you for your compliment. We are very happy to be in this fight together. And SHOFCO, we are already in so many slums, like in Kisumu, and we also in Eldoret. We are going to Nakuru next, and we are looking forward to going to other slums around. So the next move will be going to Kitui very soon. So you can let us know where you are and we can plan on how to reach you. Thank you.
I love that we're already setting up a distribution platform on this call. We only have a few minutes left, so I want to take a couple more questions if it's all right with all of you and give you a chance for closing remarks. Kathy says, we can all learn much from you and the inspiring responsiveness and resilience of the people with whom you work. You are each helping not only to keep each other safe, but also our world beyond your borders. Thank you. What do you see for the future of PPE production and post-COVID for gearing up the artisans' handiwork again? That's a really good question. I was asked that yesterday. Reema and Stephen, anyone want to jump in on that? What happens with the artisan work that you were doing before?
Sure. I think what happens with the artisans, definitely, therefore, if you saw in the photos, we have masks which are embroidered. Our PP suits have little applique on it as well. It has little embroidery on it as well. So that, people who are wearing it, maybe they are doctors or nurses or, sanitary workers, they all know that, oh, women also have this embroidery skill or applique skill. And we are using social media to continue marketing their handcrafted products as well. So one cannot work on either or. And we also don't know when the post-COVID era will come, because there's a second wave. Who knows whether there'll be a third wave before some magical vaccine is available. And that too, to the women, that informal sector workers in the villages, in the slums, they may have access to vaccines maybe 3 years down the line or 5 years down the line, at least in a country like ours. So,
yeah. Good. Let me ask one last final question, which is really about the future and hope. Just really quickly, just a few words around what you see in the future for this and what keeps you hopeful. Stephen, let me start with you.
Thank you so much, Peggy. I think for me, I'm optimistic that COVID-19 will soon be behind us, but I'm also concerned that it will have left a very devastating impact on the refugee community, in that most will need quite a long period of time to recover and blossom again. These refugees will need well-meaning people and organizations like, Aspen Institute to invest in a better future for the refugee community with whatever resources available at their disposal. We have seen in the past people and organizations give their finances, expertise, and wealth of knowledge to see the most vulnerable in our community are able to thrive. That is my dream, and hopeful that is what's going to pass. Thank you so much, Peggy.
Stephen, we can get there with you, I'm sure. Virginia, what do you see for the future and what gives you hope?
We are very hopeful, and from my point, I'm very hopeful that this is coming to an end very soon. But my concern is how soon is soon, because the cases are still going high, and we don't see until when. So what we are doing, we are hoping for more partnerships to help us sustain our COVID responses, and also more donations and support, like what we are doing with Aspen. We've already started the 60,000 mask production with Aspen, and also we are partnering with Google to make sure this is done. Also, we need people to get information out there about Kibera, how we are able to fight this pandemic, and how people are very resilient. That will still help us reach more people for support, and also know that the community can still do it.
Beautiful. Reema, to you, what do you see for the future and what gives you hope?
I think women will lead the future of this globe, and I think women are always optimistic. Every disaster also brings a lot of opportunities as well. So, you know, let's keep looking for opportunities, new ways, and as we always say, we shall overcome, and we will definitely overcome. And I think one will have to work on now new economic pathway, which is building a new economy, which is a nurturing economy. We all had taken too much for granted. We all had become very greedy and ambitious. And so now we all have to look at how do we build an economy which is a nurturing economy.
Oh, beautiful. Oh, beautiful. We are unfortunately out of time. I could hear, well, I'd love to hear so much more. And I know that if anyone of our viewers wants to continue, please reach out to us and we will connect you with all of these. Let me turn it over to my colleague, Isabel, to close us out and to tell all of you how you can support this important work. Let's see, Isabel was going to say closing remarks. I don't know if you're there, Isabel, are you there?
Sorry, I was muted. But I just wanted to say thank you all so much for joining, and thank you to Reema, Stephen, Saira, Virginia. We hope that you all will consider taking action today to support the important work of these leaders. Please use these links in this slide to learn more about the work that they are doing in their communities and how you can be involved. And also please be sure to stay in touch and use the hashtag #AspenHelpForAll on social media. Thank you so much.
Peggy, can I have one line of a song? Because
please, I was hoping you would sing. Please sing.
Definitely. We shall overcome. We shall overcome. We shall overcome someday. Oh, deep in my heart, I do believe we shall overcome someday. Thank you so much for giving us this opportunity to share our experience on behalf of thousands and thousands of artisans. We really appreciate. Thank you.
Thank you so much, Reema and Stephen and Sarah and Virginia and all of you listening today. We'll see you soon. Thanks so much. Bye-bye.
Thank you. Bye.
Bye-bye.
Thank you.